Happy Friday.
Yep, happy Friday indeed. The FDA approving a new breakthrough painkiller that could help eliminate the risks of addiction and overdose. Dr. Mina Mirhom joining us now. Dr. Mina, okay, the FDA says the pill is called Journavx, right? It's been approved for acute short-term pain that can occur after surgery or injuries. What do we know so far about this pill?
Yeah, Marina, this is a big breakthrough. First time in 25 years that we've got something new in the wake of a gigantic opioid epidemic that one of the big pharma companies just settled another multi-billion-dollar settlement. This is a medication that is actually not addictive and does not have the same risk of overdose because it works differently. This is a medicine that's not working on the brain, but rather is working on the signal that's going to the periphery of the body. It's approved now for surgical pain after a procedure and is also being looked at for diabetes pain because sometimes after a while of having diabetes you can get pain in your feet or other parts of the extremity. So it's a breakthrough medication.
Okay, and it's not an opioid. Is it an NSAID or what category of drug is this?
Yeah, Joe, that's what's exciting is we rarely get a new category of medication. This is not a medication like an NSAID that's working in that same pathway. This is working on, to be technical, sodium channels that basically control the message. Imagine if you're sending a text message out. This is controlling the receiving end, not where the message is coming from and not the same pain pathway. And that's part of the reason it's exciting because it doesn't have that same addictive potential, doesn't have that same overdose potential, and is really opening up a new category of medication for a very difficult thing for us to deal with, which is post-surgical pain and pain in general.
Yeah.
Okay, and I'm sorry, but this is not for headaches. This is not for, your average everyday over-the-counter. This is something specifically that will be prescribed after surgery.
That's exactly right, Joe. Yeah, this is the approval right now is for post-surgical pain, which has been very difficult because oftentimes when we turn to opiates in that setting, that's part of what spawned this vicious opiate epidemic that we've dealt with now for many years. It's not something where you want to take casually for just your run-of-the-mill headache or a little bit of your average day-to-day pain, but we are looking at these possibilities because the pain that's associated with having long-term diabetes, this peripheral nerve pain, is another tricky kind of pain that we've been figuring out ways to deal with. So there's other explorations of an indication for this medication type as well.
So does it sound like it could be used for like neuropathy as it relates to like nerve damage?
Exactly, Marina. That's exactly what's being looked at for diabetes. This diabetic nerve pain or neuropathy is the kind of pain that's being explored here as well. And it's one of the things that sometimes we use things off-label as a medication called Cymbalta or other medications like Neurontin that can be very helpful in that neuropathy kind of pain. But this is something that's very promising for that kind of pain as well.
Oh, wow.
Can it help with my fasciitis in the bottom of my foot? Can it help with that, man? Because they need to figure that one out.
That was tricky, Joe. I don't know if it can help just yet, but maybe it's a direction that it'll be explored as well.
Okay,
he's got sciatic pain too. I mean, he's got a whole list.
Yeah, man, it's on my foot, man. Me and all my friends.
We appreciate it. A breakthrough medication there. All right, stay with us when we come back. We're going to check on your knee, actually, and see